with me today is
Carmen Miller. We hope you enjoy this segment of Talk of the Town.
Hello and welcome to Carmen Miller's Talk of the Town, Carolinas. I'm your host, Patti Mercer, here at the Affinity Health Center, helping York County get the health care they need. Let's check it out. Hi, Anita, how are you?
Good, Patti, welcome.
All right. Anita Case, you are the Executive Director here at Affinity Health Center. Wow, this is so nice. How would you describe the role of Affinity Health Center in our community?
Well, thanks, Patti. We are a community health center, and basically what that means is we provide medical care for people who might not otherwise be able to afford care at maybe a private practice. We are just like where you go to your doctor's office. That's what we are, but for people who have no insurance or maybe have a low income and can't afford copays or deductibles for their insurance.
So you're not fully funded by federal grants, and you're not privatized, so you're somewhere in the middle for those that could potentially fall through the cracks.
Yes, exactly. We do get some federal funding, grant money, and that's for people who really have no income or very low income. For example, if someone has no income, they can come to us, they can see a doctor for $5.
Wow.
We'll draw a complete lab panel, they'll get to see the doctor, we'll help them obtain prescription assistance, and then not just medical care, but we really focus on the whole person. So we provide counseling services, we have a dental clinic, we have case management, really just trying to help people get healthy.
There's such a warmth when you walk into this building that gives you that feeling that you're going to be taken good care of. Is that because of the employees, the staff, or just the mission of what you're doing?
I think it's a combination. I mean, really, our mission is about giving good care, but with compassion, dignity, and respect. And that's something we really focus on, like making sure the patient feels worthy, that they're not a second-class citizen. They're really here, and we care for them, and we want to make sure they get the best care. So when we hire staff, we're really looking for people who are a mission fit for us, people who care and really want to make a difference for people who are in need, people who are vulnerable in our community.
Now, what does it mean to you as a nurse practitioner? You could work really anywhere, and you choose to work here at a federally funded medical practice. Why?
I just love our patient population. I love helping out. I love the challenges that some of them bring as far as the uninsured portion of their care, and just being able to provide them with sort of creative care, trying to navigate their medications in a way that they can afford it, navigate referrals, and just really help them out the best way we can.
Now, we're at the main office. You have satellite offices. Where are they located?
Yes, we have 4 satellite offices. One is in Fort Mill, one in York, one in Clover, and another one here in Rock Hill.
Now, you mentioned Fort Mill, you mentioned Clover. Those are thriving communities. In fact, all of York County, as a whole, when we look at South Carolina, is thriving. Are you surprised by the number of people that walk through your door in need of some help?
Absolutely. I think that's what's most surprising. I mean, just last month in January, we had 258 new patients come through our door.
In 1 month?
In 1 month.
Wow.
We've doubled the number of patients we've served over the last year. I mean, 100 to 200 new patients every month. Most of them are living in poverty with no insurance and have not had health care in years or maybe even ever. So it is very surprising because you think York County's growing. We've got, great economy.
This is what we hear.
Yeah, I mean,
see
that there's no need in York County, but there really is. And I think it's just letting the community know that we're here, making people aware. We want to be there for those who maybe are hidden in our community.
So within Affinity, I noticed that you also have the opportunity to have teeth examinations and things like that. I mean, I don't usually see that under the same roof as a nurse practitioner. Why is that an important part of your structure?
That's just part of taking care of the patient as a whole. Dental visits are super important to your overall health. Dental conditions can lead to various other, problems with your health overall, and so it's just an important part of taking care of the whole patient. We have mental health counseling, and again, that's just a huge part of taking care of the patient as a whole. I love the services we offer, and that was one thing that attracted me here, was that we can care for the patient just in many ways instead of just, treating their health
The
condition.
quick fix.
Exactly.
Wow. And for women, we can come and have our annual checkups and all of that's required again for taking good care of ourselves.
Exactly, and we have a mammogram bus, for example, and that comes to our parking lot, and they do mammograms for our patients on a regular basis. And so we have a women's health nurse practitioner who takes care of our mainly our women's health needs, and so we just offer a lot of services here.
Now, in terms of employees, how many do you have on staff, and how many volunteers do you rely on?
So we have about 43 employees, and we're hiring. So visit our website. But we do use volunteers. We have probably about 75 volunteers that we use. Mostly volunteers help us with clerical things, helping with tasks around the office, and then helping us with community events like planning health fairs or community engagement opportunities. Mostly we have professionals doing the medical care.
Now, health volunteers, health providers that are volunteering. I mean, dentists and doctors, are they also able to share their talents and their education by helping the community at Affinity Health Center?
They are. Thank you for asking that. We actually have 2 volunteer pediatricians who work with us, and would love to have additional pediatricians volunteer with us, or even family practice docs. I think it's really great when people have a heart for this kind of work and they want to give back to the community they live in. So we are definitely open to having more volunteer providers. We're a little limited on space, so we have to get creative, but we can utilize the help.
So your satellite offices, they operate on limited hours compared to your main office here in Rock Hill.
Yeah, our Fort Mill office is open on Wednesdays from 8 to 5, and then our Clover office is open Monday half day and all day on Thursday. Our York office is open all day on Tuesday, and our Rock Hill satellite office is open all day on Friday. Our main site is also in Rock Hill, and we're open Monday through Thursday, 8 a.m. to 7 p.m., and then Fridays, 8 to 5. So our patients can go to any of our sites, wherever it's most convenient for them, that an appointment is available.
And what about transportation itself to get here for just a visit to see the doctor?
Yeah, sometimes that's a challenge for, a certain part of our population, and so we have a case manager who really focuses her efforts on trying to get patients here the best way they can, and she works with them with getting them tickets for transportation or working with the Medicaid van, or however we need to get them here, we get them here.
One thing I will say is anyone can be a patient of ours. If you don't have a medical home and you want to kind of give back, we can be your healthcare provider, no matter what kind of insurance you have or what kind of income you have. So we just welcome anyone to come be our patient or come get involved with us volunteering. We just want to get the word out that we're here to take care of people, and we would love for the community to be more involved.
Well, that's it for this edition of Carmen Miller's Talk of the Town Carolinas. If you're thinking about moving to this area or would like to check out some gorgeous homes, simply visit homesfortmill.com. But when it comes to amazing healthcare providers, where do you go?
Affinity Health Center.
Until next time, this is Patti Mercer. Bye-bye.